Testosterone enanthate is the most well-known and widely used ester of testosterone. It's considered the European equivalent of testosterone cypionate and forms the foundation of a vast number of steroid cycles. Many believe it should be included in every steroid cycle. It's an injectable anabolic steroid in the form of an oily solution designed to release testosterone slowly. It has a long-lasting effect, with an active duration of about 2 to 3 weeks. This is achieved by attaching the testosterone molecule to the enanthatist. After injection, testosterone dose and T become active until the ester starts detaching from it, a process that happens gradually, allowing for a slow release of the hormone into the bloodstream. Testosterone levels peak around 24 to 48 hours after injection, and then decrease slowly until the hormone is completely metabolized. Medically, it can be administered every 2 to 3 weeks, but optimal effects are usually achieved with injections every 10 days. In medicine, it's the most prescribed testosterone-based treatment. Among bodybuilders and athletes, it's also one of the most used anabolic steroids, affordable, easy to find, and highly effective. Like all testosterone-based steroids, regardless of the ester, testosterone enanthate has an anabolic rating of 100 and an androgenic rating of 100. Testosterone itself serves as the reference point by which all other anabolic steroids' anabolic and androgenic values are measured. Medically, testosterone enanthate is one of the best options for treating low testosterone levels, a condition affecting millions of men worldwide. It's well tolerated by most users since it's structurally identical to the body's natural hormone, even though it's synthetic. Athletes use it in doses far above therapeutic levels to increase muscle mass, strength, and overall performance. Testosterone enanthate enhances protein synthesis, what gym enthusiasts refer to as anabolism. Another mechanism is the increase in red blood cell production, which boosts muscular endurance and recovery after physical exertion. Because of this, even endurance athletes like cyclists use testosterone enanthate, though in much lower doses compared to bodybuilders or weightlifters. Other mechanisms by which testosterone enanthate enhances muscle growth and performance include increasing IGF-1, a hormone through which growth hormone exerts its effects in suppressing glucocorticoids, such as cortisol, hormones with strong catabolic muscle-breaking effects. Often regarded as a bulking steroid, testosterone enanthate is actually a versatile, neutral compound suitable for both muscle gain and cutting phases. When the goal is mass gain, high-calorie intake is required, which can also increase fat retention. For cutting, a calorie-restricted diet is needed. Testosterone enanthate helps preserve lean muscle tissue while significantly boosting metabolic rate. Water retention can occur, but it usually subsides after the cycle ends. Beginners often think that using a powerful steroid like testosterone enanthate means they can skip the hard work, but results still require proper diet, intense training, and consistency. There are no magic injections or pills. Following a disciplined routine also allows lower doses to be effective, reducing the risk of side effects. Typical dosages for athletes range from 250 milligrams to 750 milligrams per week. Above this range, estrogenic side effects become more pronounced without additional muscle gain. Compounds like anadrol 50 or dianabol can be stacked for massive gains, while decadrabalin or equipoise are better suited for leaner, more defined results. The most commonly tolerated dose is 400 to 500 milligrams per week, usually split into 2 injections, for example, Monday and Thursday. Injections are administered deep intramuscularly. For medical testosterone replacement therapy, doses range between 100 to 200 milligrams every 7 to 10 days. Testosterone is a potent hormone with numerous potential side effects, most of which stem from its tendency to convert into estrogen. Testosterone is considered an estrogenic hormone in the sense that it can be converted into estrogen, the female hormone, through the aromatase enzyme, a process called aromatization. Water retention occurs fairly quickly, sometimes accompanied by fat gain, though this depends heavily on diet. Water retention can also increase blood pressure. There's also a risk of gynecomastia, the development of breast tissue in men. This is why Nolvadex and Orproviron are often added during the cycle. Arimidex is even more effective, but more expensive. However, a drawback of Arimidex and aromatase inhibitors in general is that they can significantly lower HDL good cholesterol when combined with steroids. Nolvadex doesn't have this effect. In fact, it can improve cholesterol levels. Some believe that using antiestrogens during a masturbating cycle can slow progress, so they're used only if necessary. Early signs of gynecomastia, a small lump or pain under the nipple, mean that either the cycle should be stopped immediately or Nolvadex should be introduced, or both. Arimidex is used for prevention, while Nolvadex is the treatment once symptoms appear. Gynecomastia becomes established, only surgery can remove it. Other androgenic side effects include acne, increased body and facial hair, oily skin, hair loss in genetically predisposed individuals, and prostate enlargement. Proscar can be used to minimize these issues, but may also reduce anabolic effects. Acne depends on individual sensitivity, and many athletes report breakouts 1 to 2 weeks after ending a cycle, likely due to hormonal fluctuations. It commonly appears on the back, shoulders, and neck, and can last from weeks to months. Testosterone enanthate causes pronounced virilization in women, even at very low doses, and is therefore not used by female athletes. It can also negatively affect cholesterol levels, increasing LDL bad and lowering HDL good, so it's important to take long breaks between cycles. Supplement with omega-3s and maintain a clean diet low in refined carbs. The main long-term concern among steroid users is that extended use can nearly eliminate HDL while dramatically raising LDL, which is why many bodybuilders end up with heart problems at a young age. It's also very likely that natural testosterone production will be suppressed after a cycle. To preserve muscle gains, post-cycle therapy PCT with Nolvadex and Clomid is necessary. Some weight loss is inevitable after a cycle due to water loss, but the main goal of PCT is to maintain lean muscle mass. Gradually lowering the steroid dose at the end of the cycle, dose and T prevents suppression only proper PCT does. HCG is often used during the cycle in doses of 250 to 500 IU to prevent testicular atrophy and severe suppression of natural testosterone production. If post-cycle therapy is skipped, the body may recover naturally in 4 to 5 months. But most muscle and strength gains will be lost, and users may experience side effects like erectile dysfunction, low libido, depression, and fatigue. Despite the side effects, many users tolerate testosterone well, especially considering the results it delivers, hence its enduring popularity. Most of the side effects mentioned above can be managed with anti-estrogens and by avoiding excessive doses. Since testosterone is the hormone most similar to the body's natural production, it's generally well tolerated overall.